שנית, מה אם אתם מגיע חולה שני? Maybe we go for a walk. Yes, the only thing I'm going to do, I'm going to put you on speaker. Okay? Just a second. Hello? Okay.
Not a problem. We proceed now?
Yes, we can proceed now.
Okay. Dr. Waismann, can you tell us what is the procedure for detox in the first time, and what is different about this treatment and different for treatment with methadone?
Okay. Okay. First of all, this is a medical treatment.
Okay.
Because it doesn't matter why somebody start using drugs, heroin at one point. Once they use it again and again, they develop a medical problem, a medical disease. Okay?
Okay, I understand that. Could you explain what is the medical disease? What is the effect of heroin?
Okay. Our body produces a substance that the name is endorphin. Endomorphin, which is a kind of natural opiate. Now, once people start using external heroin, this system will go down and down and down. And once the system starts going down, the patient will need more external heroin even to feel normal. Like this, they develop a dependency. Okay?
Okay, I understand that. Because I asked you that because it's a myth about your treatment among the dependents. You know, the dependents say your treatment is like a brainwash. And I want to explain that the differences of a brainwash and your treatment. What is the first procedure you apply on them?
Okay, to wash the heroin out of the body does not repair the damage of the dependency. So this is very important to be understood. So let me phrase again. So heroin causes two big problems. One, the endorphin system collapses, so the patient needs heroin even to feel normal. That's why people give the methadone so they can feel without medical problems. And there's a second problem, that in the brain will produce new receptors to collect all the heroin. So the regular treatments, even if a patient succeeds to stop heroin, always he's going to have a lot of receptors in the brain that will ask for heroin. That's why in Romania, everywhere else, some drug addicts, they succeed to stop, but they always go back because the brain keeps asking for it. So my treatment is the only treatment that I do two things. One, I recover the endorphins in the body, so the patient doesn't feel the need to use heroin and he feels well. Second, I block the receptors in the brain, so after the treatment, the brain is not asking for heroin anymore. Do you understand?
Yes, I understand that. Let's talk about the treatment with methadone. Usually, the methadone is used to help with drug addicts to renounce the heroin. Yes, I'm right. And the methadone, you have to take the first 10, 50, 100 grams hour, and after that you take less. But usually in Romania, or I speak with many drug addicts, they say increase the number of pills of methadone they're taking. Why is that?
First of all, methadone is just like heroin. Methadone was created not to treat the patient, but to protect society from the patient. People thought we give the methadone so they don't use heroin, so they don't steal, so they don't do prostitution. But once you use methadone, you create more and more receptors, and always your brain will need more and more methadone. Methadone is a very dangerous substance because when the patient is taking a lot of methadone, they don't feel any pain. So they can develop very different illness, disease, without feeling pain. And they can die from those diseases because they don't know they are sick, because the methadone don't allow them to feel pain. So methadone is like heroin, but is synthetic and is much more stronger than heroin. So for the patient, methadone is a terrible thing. For the politicians, for the society, they thought, okay, they take methadone, so they don't need to steal. But it doesn't work that way, because most of the patients that take methadone, the body suffer from the methadone, the brain makes more receptors, at the end they go back to heroin, but they use much more heroin than before, because they have much more receptors. Do you understand?
Yes, we can say the methadone is worse than heroin, and also the effect is similar like heroin.
I don't like to say worse. Heroin is bad enough, but methadone is stronger than heroin, and methadone will cause a situation that the body will need more and more and more.
How many years do you practice this treatment on drug addicts?
I developed this approach 14 years ago. 14 years ago, I decided that once you put drugs in your brain and you develop a medical illness, we needed to look for answers on the medical scene, not on the psychological or social, because the problem is located in the brain. Most of your Romanian heroin addicts, one day in their lives, they were good boys. They didn't die, they didn't born bad. They die bad at the end, because once they become dependent and nobody offer them an effective, safe and humane way out, they are kept in this situation and they will do anything to find the drug. So they become bad people. Not because they are bad, because nobody is helping them in a humane and effective way to be good again.
How many patients do you have treated this year with success, you know?
Listen, until today I have treated between 10,000 and 11,000 patients.
In all the world?
From all over the world, people come to Israel for treatment. Yes.
Your method was adopted by another doctors, another countries. I don't know. Do you expect your method your treatment in another country?
Yes, yes. There are different countries in the world that they came to learn from me, and they adopted, but in a very peculiar way, in a very small way. Why? Because
what do you want to say with that in a very peculiar way?
That's the problem that we have even in my own country, Israel. Why? Because for so many years, people are treating drug addicts with methadone, with therapeutic communities, with social workers, with psychologists, that today, to change 180 degrees, to say everything we have done is wrong, let's change the approach, will take some time. Now listen, to perform my treatment, you need to do it in the general hospital. You need anesthesiologists, you need intensive care nurses. It's a completely new setup. So it will take some time for the governments to make this switch. But we have a lot of developments. In Australia, for example, there is a public hospital using my treatment that I teach them. In America, there is at least 20 clinics using similar approaches. Even in Europe, there are some places that they start going to the same direction. The difference is that I have treated more than 10,000 patients, so I do have a lot of experience, and they are just learning right now. You know, it takes time for you to develop the procedure and to bring the procedure to a standard that will be safe for every patient. So it's a process. I believe that the process has started. I believe truly that 30 years from now, what I am doing is what people will do all over the world. The question is how fast the government will understand that they need to fight the disease and not to fight the patient, and how many people will die until they make this decision.
Well, you spoke with the authorities in different countries to implement this treatment.
Yes.
And what was the response of this outside the government?
I always had an excellent response from the people from the field of anesthesia and intensive care, because they can understand the technology of the treatment. But again, today, who are in charge of this issue is not anesthesiologists, they are psychiatrists. Now, if you understand, I'm taking this field from their hands. So there is a lot, everywhere in the world, there is a lot of fight on that. The psychiatrists, they don't want to lose this market. And the anesthesiologists...
If I understand right, you don't need to work with the psychologists. You need to work with the doctors, the medical team.
Yes.
To resolve the problem.
Right, right. I believe that some people, some patients will need psychological help. Why? Because for 10 years, for 20 years, they lost their self-esteem, their self-confidence, their self-respect. So they will need psychological help, but not psychologists to treat the drug problem. The drug problem has to be treated by medical doctors. And in medicine, there is one kind of doctor who works with narcotic, which is anesthesiologist. Do you know? Just please think. Every day in Romania, in the operation room, you see doctors giving narcotic to patients for anesthesia. And then after the surgery, those doctors, they succeed to take the narcotic away. So, which kind of doctor is working with narcotic? Not psychiatry, not psychology, anesthesiologists. Do you understand?
Yes, I understand that. In Romania, what is the problem with the government? I don't know. What is your problem? There's your treatment, or what else happened here?
In Romania, I believe that the situation is much better than America or other countries. Why? Because America, for example, they have a huge industry of methadone. They sell methadone to the whole world, so they are very committed. Now, Romania is a country that I could say all the political changes that happened in Romania in the last 20 years, I could say is a fresh country, trying to not to clean, but trying to build a new identity. And Romania is not producing treatment for drug addicts to export. Romania is importing. When you are in this position, you can choose better because you are less committed. So Romania, my experience with Romania, maybe because of the FORAD organization, that in my opinion and my experience is doing an excellent job, we are not having problems with the government. We are in the process of explaining the government, talking to the government, making plans with the government to try not to make a revolution from today to tomorrow, but to try to plan how I, Dr. Waismann, can pass to Romanian doctors, even in the beginning a small group of doctors, my experience, my knowledge, so they can start in a small unit, and afterwards, once they gain more experience, they can pass this knowledge to other Romanian doctors. So I believe, different from other countries, In Romania, I'm more optimist because the people I met until today are people with open mind and they want to do the best for the patient. And I don't have to try to prove that what I do is the best. My results are my results. A patient come here to Israel almost dead, and after a week he leaves home free, healthy, and more than that, without being mentally hungry for drugs. So the treatment is not a miracle. Some patients will need other kind of help. A girl that is a prostitute for 20 years, she will need social rehabilitation. But after she comes back from Israel, the table is completely clean in 100% of the patients. Do you understand?
Yes, I understand. But I want to explain me and the Romanians. What is the difference between your treatment with naltrexone and methadone? What is
okay, let's put things very clear. I cannot compare my treatment with methadone because methadone is not a treatment. Methadone is a legal way to give very dangerous drugs to people, point. So I cannot, it's like comparing my treatment with heroin. What's the difference? So I don't compare my treatment with methadone. Now, naltrexone is a drug that exists, a medication that is in the market for 30 years. What's the problem with naltrexone? How come I succeed and other people don't succeed with naltrexone? Because every patient is different. One patient that is using heroin for 1 year, they have a certain amount of receptors. Some patient using heroin for 10 years is a completely different case. What they do with naltrexone in Romania or in England or in Switzerland, they give the same amount of blockage to all the patients. So you have one patient too much blocked, which will make him feel very not comfortable, and you have one patient with little block. My procedure, the ANR procedure, allows the doctor to know exactly how to block each and every patient. So each patient receives the treats his brain needs. Do you understand?
Yes, I understand that. So let me rephrase it. The drug addiction change, drug addiction with heroin, for example, change in drug addiction with methadone. In your treatment, did drug addictions change in naltrexone, or do you are completely healthy about this treatment?
I don't understand the question. I'm sorry.
So you ask, I'm sorry to intervene, but you ask if they become addicted or on naltrexone?
No.
Yes.
No. Naltrexone does not cause addiction. Naltrexone doesn't change the mood of the patient. When the patient takes naltrexone, it's like he's taking vitamin C. The only thing naltrexone will do will block the extra receptors that was developed in the brain of the patient because he used for a long time. So once I block the extra receptors, the patient is balanced, is normal again. So after 6 months, 10 months, 1 year, each patient is different. When they stop the naltrexone, they are completely normal. But when they go back from Israel home to Romania, with the naltrexone, they feel normal too, because the extra receptors are blocked. Now, people that don't have my treatment, even if they become clean, they have all these extra receptors asking for drugs. So they want to be well, but they are 24 hours a day hungry for the drugs. My patients, they don't feel this hunger.
I understand that. Okay, what is the cost difference between heroin or methadone and your treatment? What is the economical differences?
Again, if my treatment, and hopefully God's willing, will be available in Romania through a governmental hospital, my patient will cost very, very little, because it's just 1 day of hospitalization and 4 hours of anesthesia. Now methadone, a patient needs to take methadone for 10 years, for 20 years. Methadone, they develop very big problems in the liver. Methadone, they use heroin and they spread AIDS all over the place. So you need to understand, each patient in Romania that is not becoming healthy, and with methadone you don't become healthy, is a patient that will bring AIDS to other people, will bring hepatitis to other people, is a patient who will be sick many times and will be hospitalized. What I'm trying to say, each patient that will be treated by my technique will save the Romanian people millions. And the cost of the treatment is not very high, because it's just 1 day of hospitalization. Now when you do this treatment in a private setup, of course costs a lot of money, because anesthesia of 5 hours costs a lot of money if it's private. Intensive care costs a lot of money if it's private. The doctors that work, the team, you know, if you have to pay private one by one, of course costs a lot of money. That's why our goal, my goal, and the goal of the Ford organization is not to bring a lot of Romanian people to Israel, is to bring the treatment to Romania. And that was our agreement from the beginning. I have to tell you 2 things which is important for the public to know. Me, Dr. Waismann, will never, and this is I give my word, I will never open a private clinic in Romania. That's not what I want to do. It's not a business organization. What I want to do is to teach the Romanian doctors so they have the treatment there, and until then, people that can afford and can come here, why not? Why to let them die? So I can treat them here until the government decides to go ahead.
Okay, sorry if I ask you that. What is your motive to do all that thing, the treatment, I don't know. What is your motive?
My motive is a very simple one. It doesn't matter how you call him, but I do believe in God. I have 6 children and I live in a very turbulent and very dark world. And God put me in a position that I could change the reality of such a terrible disease. And once I realized that for me, Dr. Waismann, doesn't matter if I treat another 1,000 patients. I will matter in the world if I teach another 1,000 doctors. So for me, I can look back and say, okay, I treated 10,000 people, I'm very proud of my work. But I'm too young to sit back and say I'm proud of my past. From now, my biggest goal is to change the perceptions in the world about this problem. Patients, they are not criminals, they are patients. They become criminals because we, the society, don't allow them different. So, as I said before, I would like to say it again. The governments, they need to spend less money fighting the patient and more money fighting the illness. That's my motivation.
Okay, explain us the procedure. And the patients come to you in Israel. What is the first step to take with the patient? For example, Catalin.
Okay, all the patients that they come to Israel, they come after they were interviewed and they filled up a medical questionnaire so I can prepare myself. For example, for a patient with a heart problem, for a patient with diabetes, a patient with ulcer, they are human beings, they have other problems sometimes. So once I see the medical questionnaire, we fix a date. The patient fly to Israel, somebody from my clinic will be waiting for the patient at the airport and will bring them for the hotel. The next morning they come to the hospital, which is a governmental hospital, and in the hospital we start making blood tests, electrocardiogram, all the medical clinic assessment to learn more about the physical condition of the patient. The patient receives medication to be calm, and then once the body is ready for the treatment, we start the anesthesia. During the anesthesia, what we do, we clean the receptors in the brain with medication. Nobody cuts anybody. It's not a surgery. It's just medication. But the patient is on a deep sleep, almost anesthesia. And then, by cleaning the receptors, I precipitate. I make all the suffering, instead of a week, 2 weeks, everything will happen in 4 hours. So in these 4 hours, myself, 2 anesthesiologists and an ICU nurse, we control the situation of the patient so he can go safely through the procedure without feeling anything because he's asleep. At the evening he wakes up from the treatment, they will be very tired, they sleep in the hospital, we assist them during the night, and usually around the afternoon they are strong enough to go back to the hotel to rest for another day or 2. I will visit them at the hotel to talk a little bit about life, about the future, what to expect. Usually they make another day of tourism and they fly back home healthy. Hello.
Hello again, Dr. Waismann. Can we start now?
Yes, please.
Yes. One of the questions is what are supposed to do the Romanian government for you to come here in Romania and to apply this treatment?
Listen, I believe that the first thing, as happened in other places, they need to make a decision if based on everything they learn about myself, if they believe I can help. And if they believe I can help, they should invite me. That's first of all. So I can sit with them and explain them exactly what I can do and how is a training process. And then they have to allocate a hospital, 2 beds, and give me the name of one anesthesiologist that will be the head of the team that will work with me. So they will make a small team, and in 1 year I can bring them the knowledge. We make a program. I will come to Romania 4 or 5 times. I will teach patients together. I have a very methodic way of teaching, so I sit with them, I show them the program, and that's what the government needs to do, to start conversations about that.
Okay, what's supposed to have as the technical equipment?
The technical, we need a small room that would be with equipment of an intensive care, like monitors, respirators. It's not like intensive care, it's almost intensive care, and 2 beds.
Okay, and the pills, the medicaments, the drugs, do you have to administer to the patient we have here in Romania, or do you have to import from?
No. All the medication I need is medication which is available in most hospitals in the world. I don't invent any medication. The difference is that I apply modern medicine in a field there is almost no medicine at all. So all the medication I need, I believe that is available in any hospital in Romania.
Okay, what is the cost of you coming here, and what is the payment for you?
Listen, I don't charge, I don't sell knowledge. Do you understand? I don't sell knowledge. Of course, there are some expenses that are supposed to be covered, but believe me, that's not the point, because this point is almost irrelevant. Do you understand? I don't. You know, today in the world, you have many high-tech companies selling knowledge. I don't do that. I don't sell knowledge.
Your training is for free here in Romania, or over the wall?
Listen, I don't charge knowledge. With that, I cannot, I'm not so rich that I can pay the expenses for the Romanian government. So of course there are expenses involved. You understand? But believe me, it's like treating 4 patients. It's not something relevant. It is even worse to talk about. Let's say if you take the budget of drug addiction in Romanian and you divide in 1,000, it's not even one part. The money is not the problem to learn the procedure. Do you understand?
I understand that. Your knowledge is for free.
The knowledge is for free, but the expenses of the doing it, somebody will have to pay.
Yes, I understand that. Okay, thank you very much, Dr. Waismann. I hope to see you someday. And nice, I don't know, good luck anyway for your treatment, because I think it's very important to succeed. You succeed with your treatment.
I would like to tell you something very small. You know, I'm a physician, I'm a doctor, and I work in hospitals. But in the world today, you are even more important than who I am, because I can do whatever I do. If nobody knows about, nothing will change. And I always believe that the change will come from the people. The people in your country about this subject, they live without hope. Once they will have hope, they will start pushing their politicians, their leaders to make the right move. So what I'm trying to tell you is that on your job you are doing right now, there's a great responsibility on it, and I believe that you already are part of a historical change in this field in Romania. Thank you.
Really, I hope so, and I'm agreed with you, and I hope to change something.
Okay, thank you very much.
Thank you very much also, and repeat, I hope to meet you someday.
Okay, hopefully soon.